Hi, my name is Kayliana Tononi. This is my tracheostomy care and suction skills return demonstration video for NR224 Fundamentals 1. I'll do a quick scan of my room. That is my bookshelf where I will be doing the demonstration. Nothing on my nightstand, my bed, rest of my room. Nothing taped to the walls, nothing on the ceiling. Okay. So this is where my return demonstration will be. I don't have a mannequin, so I thought I'd use a blender bottle. So this top part I will use as the mask, so like the oxygen mask for them. And then this would be the tracheostomy tube. Okay. And then I have a cow because I'm supposed to auscultate lung sounds. I don't know. I couldn't think of anything better. I'm home alone, so there's that. Okay. Hi, my name is Kay. I will be your nurse this afternoon. Can you give me your name and date of birth? Good. So I understand that the doctor ordered tracheostomy suction and care for you. And then I have all my supplies, so I put it on a clean surface, hand hygiene, and provide privacy. So what I will be doing is I will be taking a catheter, which is kind of like a small tube, and putting it into your tracheostomy to suction out any secretions that you may have down there that could block your breathing, and we don't want any of that. It could also cause infections. And I won't be down there very long, 10 seconds, 15 seconds max, because it can be very uncomfortable for you. So I will turn your oxygen up so that way you have you're hyperoxygenated, and then I'll put your oxygen back on in between passes. So I'll do it about 2 times for you. And then I will clean the site, make sure everything's all good, no infections or anything like that. And then I will replace all the gauze and the ties around your neck for you. Is there any questions? Good. Is it okay that I perform this procedure for you? Okay. So I would raise the bed up to waist hip level and semi-Fowler's position. I'm going to auscultate the lungs before I begin. We're just going to do it on his little lungs. Take a deep breath for me. And another. And one more. Another over here. And last 2 breaths for me. And last one. Okay, good. Put him back in there. So I will do hand hygiene, and I will put on my mask and protective goggles, which are my glasses. His oxygen mask on. Open my kit. My basin. Pour my water in there. And then I will turn everything on. The suction, turn it up to about 110. Turn the oxygen up to about 8. So that way they're getting more airflow. And I put on my gloves. Oh, my phone's sick. Okay. Okay. My right hand will be my dominant hand, my left hand will be my non-dominant hand. So I'm going to take the catheter and coil it up into my right hand and attach this to suctioning. And like I said, I turned it up to about 110. Should be between 100 and 120. Alrighty. I'm going to dip it in the basin, flush it out, make it easier for insertion. Then I am going to remove the mask and insert until resistance, ooh, got a coil on there. Insert until resistance is reached, or there's resistance, or the patient coughs. Then I would pull back about 1/2 inch to 1 inch, and then rotate it out. Put the mask back on, allow them to breathe. Flush it out again. Assess their respiratory rate, make sure their skin color is normal, so there's no cyanosis or pallor, and check their pulse ox levels. Just let them catch their breath again for a moment before I go back down. We'll say it's been a minute. Respiratory rate's good. No cyanosis, and pulse ox is about 99 to 100%. So I will flush it out again, remove the mask, and go down until resistance is met or the patient coughs, and then rotate it back out. And close the mask and discard of everything. No abnormal secretions or anything like that. Discard of everything in the appropriate receptacle. I'll just put it down there. Gloves as well. Are you doing okay? Good. Now I'm going to hand hygiene, and I would put on some clean gloves because I don't want to touch it if it's dirty. And I will pull out the fenestrated gauze, assess for coca, so color, odor, consistency, and amount. I don't see anything abnormal, so I will throw that out. And I'm going to open my care tray. And I would pour, or have someone pour saline into another basin for me, and put my cotton tips and my gauze in there to moisten them. Put my gloves on. These are the tight ones. Well, I'll just go with it until I put it on. Use a scooping method for the other one. Put these gloves on a couple times so they're kind of sticky. Okay. They fit a little funny, but that's fine. Alrighty. So I don't need these because I'm not cleaning out the inner cannula. So then I will give them a drape. Keep them nice and dry. Stay within that 1 inch margin. Place the shiny side down. It's there. Okay, so then I would open up the mask, unlock the old inner cannula, throw that away, and put a new one in. Make sure to go with the curvature of the throat. You don't want to go the opposite way because that can cause issues. And then I would take a cotton tip, clean in a circular motion away from the stoma site. Discarded that one. Do it again on this side. Then take the gauze. Do one swipe motion. Another up here. and one good one. And then I will pat it dry. And then I'll take new fenestrated gauze and put it underneath. And then I'll take the ties. So if there were ties on here, I would undo one tie at a time and replace it, so that way nothing falls out of place. So I would secure the trach with one hand, tie through one side, pull around, tie through the other side. Make sure I can fit 2 fingers under there, so there's a 2-finger slack. Use square knots. You want the slack so that way it doesn't cause any friction on the patient's neck or irritation for them. And then put the mask back on. You doing okay? Is there anything else I can do for you? Okay, good. So then I would discard of everything. Put it all in here. And auscultate lung sounds again. So I'm going to pull my cowl out again. Deep breath. Another. Another deep breath. Another. 2 more. And last one. Very good. And I would assist the patient to a new comfortable position. And then hand hygiene, bed rails are up, bed is locked and lowered, and call light is within reach, and hand hygiene. I believe that's everything.